We've gathered here today to discuss a very important topic, that is awareness about breast cancer. I was reading a report by the Site Care Hospitals in Bangalore, and the statistics was that 14% breast cancer accounts for 14% of cancers in India, and I think it's the most common cancer spreading in women. So, given that we need to be more aware, we are technologically sane. We read so many things about different types of diseases on the internet. It's very important to hear from an expert, get all our questions answered, and that's why we have with us Dr. Ojus Wadhwa. Thank you so much, Doctor, for joining us. And we also
Thank
have the
you.
team of Manushala who will be sharing their screen. Uh, Over to you, Doctor. I would love for you to introduce yourself and then take us through the session. And thank you again, everyone, for joining in.
Okay, thank you so much for having me over. I'm Dr. Ojus Wadhwa, and I have been doing breast surgeries for more than 20 years now. And when I took up this profession and decided to specialize in breast, the whole idea was it's a light branch and there are no emergencies to deal with. And believe me, in a period of 20 years, breast cancer has become so very common that nowadays, you just cannot predict who will get it and who won't. So this need that you all are doing, this whole idea of conducting these, sessions where you're sensitizing people about the need to get examined is so very important. I'm really glad that you've taken this initiative. And coming to breast cancer per se, if you really go to see that, it's extremely common now. In fact, I don't think there's anyone who can say that I don't know a breast cancer patient. You either find somewhere in your community, in your society, in your relatives, someone or the other who has suffered from breast cancer. So nowadays, with the incidence that has gone high, we find that India is in a very precarious position because in our society, in urban areas, the incidence is as much as 1 in 22 women in their lifetimes. What this means is that if you calculate the lifetime expectancy of developing breast cancer, out of 22 women, at least one will develop breast cancer in her lifetime. This is what it means. Whereas in urban areas, it's 1 in 22, in rural areas, it's 1 in 65. We lie right in the middle because if you consider US, UK, US it's 1 in 8, and UK it's 1 in 10 women. Whereas Far East, like Japan, Vietnam, the incidence of breast cancer is very low. So we are in the middle, and as much as we are aping the West, our diet is going more towards Western diet, we find that there is more incidence of breast cancer. So moving on to the next uh, slide, I would like to actually, this is, just the basic structure of the breast that has been discussed, where you have the skin, the actual breast tissue with the glands in the middle, surrounded by fat, and the muscle at the back. Now, what is important to know in this structure is that because there is fat in the breast, these small lumps can get hidden. And especially in a country like India, we find that the age of incidence is pretty young, unlike in the Western countries where it is more or less 55 plus women who develop breast cancer. In India, the peak incidence is around 45. And at the age of 45, the breasts are very dense. So we end up missing a lot of lumps. So we in India need to be more aggressive with our awareness programs and getting ourselves screened as early as possible. Then the next slide will actually tell you about what I talked about, the incidence, that is 1 in 22 women, and in the urban areas, that is 1 in 22 women. But all this is fine, talking about incidence, talking about, these are just statistics, these are just numbers. But what does it actually mean for each and every woman is what we have to focus on. And for that, we have to discuss what all do you need to look for and when do you need to get yourselves examined. My take on this is you need to get yourselves examined at the earliest, maybe by the age of 25 onwards, at least get one checkup done to know what is the status of your breasts. When it comes to a person who has a history of breast cancers in the family, then it has to be at least 5 years before. So let us say if the mother had breast cancer at the age of 38, the daughter should get it at least 5 years before. So at the age of 33, she should start her screening at least. So these little things are generally overlooked because they know that the mother had it, there is anxiety, but at the same time, they don't know when to begin screening. So the ideal time to start screening is 5 years before when the mother has had breast cancer. And what all do you look for? You look for you have to look for lumps, you have to look for nipple discharges, you have to look for any thickening or any redness or maybe nipple retraction or any pain. But most of the times, the lumps that you see are painless lumps in case of breast cancer. So the whole idea is to examine your breast on a regular basis. So when do you examine them? You have to examine your breasts around the 5th to 6th day of your menses. So once your periods start, on the 5th or the 6th day is when you actually examine the breast. And this has to be done very regularly just to understand what your own breast feels like. So I would suggest that every woman stands in front of the mirror at the time of before bathing and then just looks at the level of the nipples, raises her hands, sees if there's an unequal level of the nipples or if there's any pulling in of the skin or there's any dimpling or nipple retraction or there's an unequal size of the breasts. Mind you, size of the breast, honestly, about, I would say, 30% of women do have unequal breast to some extent, which is there from the beginning, which you will notice after puberty. However, at the time of examination, she has to realize that what has been always there, if there's a change in the size, then it is considered significant. Then comes your nipple discharge. Now, there's always an apprehension. I get a lot of patients saying that, when I express there is certain amount of, there's milk or there's a watery fluid that is coming out of the breast. Please remember that when you press the nipple and something comes out, it's not as significant as something that just keeps flowing on its own. So if you find that there is a discharge that happens spontaneously, then it is considered significant. Secondly, the color of the discharge matters. So if you find that there is, let us say, milky white discharge, or there is yellowish discharge, or a greenish discharge, these are considered 50-50. But anything that is a bloody discharge needs to be investigated immediately. Secondly, if the discharge is on both the sides equally or even unequally, but it is present on both the sides, then most probably it is related to your hormones. So again, need to get investigated, but not to worry. So these little things need to be checked out at the right time. Next is, I would say, any kind of irritation or some kind of an eczematous uh, lesion near the nipple, where sometimes the nipple just appears dry and flaky and starts, and it's not healing in spite of any ointment or cream that is used, then get yourself checked out. So, looking at all these symptoms, one wonders whether you need to do anything particularly. So yes, I would say at least once in 6 months, show it to some clinician, either a gynecologist or a breast surgeon, and get a clean or a clean chit from those from the clinician. Having talked about all the symptoms and everything, I don't want to, worry you or depress you at the same time. I would like to mention this that today, with the kind of awareness and early diagnosis that we have been able to treat, and I can't use the word cure, but yes, almost cure women of breast cancer. Because a lot of women are actually coming forth for investigations. We are so used to getting our blood tests done routinely, especially corporate packages are there and everybody gets it done on an annual basis. But when it comes to a breast examination, people are hesitant. So my request is please just take that a few minutes off, go to a clinician, get your breast checked out, and get a mammography done if you're above 40 years of age, and a sonography that if you're less than 40. But get yourself checked out at the right time, and you would really be doing yourself a favor. So, all in all, I feel knowing the symptoms, knowing when to get the investigations done, at what age you are supposed to do them, is an important thing. But why not have a kind of roadmap to prevent developing breast cancer? And for that, you first need to know what are the risk factors involved. So, everybody is not probably equally prone to breast cancer, but at the same time, you have to know that some certain uh, diseases are prone, for developing breast cancer. So, I would say regarding risk factors of breast cancer, I would really expect most important significant risk factor would be being a female, which is quite unusual because when I say that, what I'm trying to say is that even men can get breast cancers. So out of 1,000 breast cancers detected, there's at least one male breast cancer that can be. So it's 1 in 1,000 breast cancers. So it's not that males don't develop, they do develop breast cancers. And the sad part is when a male develops a breast cancer, he doesn't have the protection of the fat that we have in the breast, which allows a longer period before it spreads. In a male, it spreads very easily to the chest wall and rest of the body. So even the males need to be careful about getting themselves checked out if there is even a slightest bit of suspicion of breast cancer. That is one. The second is age. I wouldn't, honestly, looking at my practice, I've realized that age is no more a criterion, though we talk about it, but still, earlier it was breast cancers were more common in older age groups. But in India, and especially now, we find that younger and younger women are getting affected. So, how far you can call age as a risk factor, I really don't know. But yes, age is considered one of the risk factors. Then you have certain families that have certain mutations, genetic mutations like the BRCA1 gene, the BRCA2 gene. So that is something that we just cannot, help it. These are uh, things that are not in your control. But yes, if you do know that there is this history in the family, then I think you need to be more careful about getting yourself checked out. The next important point is where you have started with your periods at an early age. In that case, yes, you're more exposed and there are more chances of getting breast cancer. So any periods, those who have got started with periods before 10 years of age, or those whose periods go on beyond 55 years of age, they are the ones who are more prone to developing breast cancer. What this actually means is that exposure to the hormones, the estrogen hormone, is what promotes development of breast cancer. So that happens with every cycle, with every monthly cycle. As a result, we have to monitor the number of cycles that you've gone through. That is why those who have had children, those who have breastfed, they are the ones who do not, I would say, have lower risk of developing breast cancer because their breasts have function. The chances that during pregnancy, because there are no periods, there is no estrogen exposure. As a result, those many number of cycles are less in that lifetime. And hence, those women who have given birth to more number of children and have breastfed are more protected from breast cancer. It's not 100% guarantee, but at the same time, yes, it is protective. Then, like I said, a family history of having breast cancer. Now, which family are we talking about? Obviously, from the maternal side. So, if the mother has had breast cancer, or if the aunt has had, maternal aunt has had, so the higher you go, the second degree, third degree relatives developing breast cancer are the ones who are going to, that makes you more prone to developing breast cancer. Same thing with ovarian cancers. That is another place where, a condition where, if you are suffering or anyone else from the family suffering from ovarian cancer, you would definitely be at a higher risk of developing breast cancers. Apart from these, there is colon cancer, prostate cancer in the father. They are also the ones who have these are syndromes. They're different, groups of people who are more, I would say, are more susceptible to developing breast cancer. And of course, previous radiation therapy, which unfortunately has to be taken maybe for a lymphoma or something like that at an early stage. In that case, those patients are more prone to developing breast cancers. But these risk factors that we talked about are actually not in your hands. They're not in your control. This is something that you're born with. So those you really cannot control. You can only be aware of them and keep an open eye. But those risk factors that are under your control are the ones where you can actually try and prevent developing breast cancer. Most important is being physically active. So when I say physically active, I don't mean that you have to go and gym every single day, but at least 30 minutes of walk 5 times a week should be helpful with a little bit of maybe gymming or yoga or something like that. So being physically active is definitely important. Being overweight or having obesity at the time of menopause, again, is a significant risk factor, which you can definitely avoid by taking care of your nutrition and exercise. Then there are people who have taken maybe IVF earlier, or are on some kind of hormonal treatment for some reason or the other. They are again prone to developing breast cancers. Today, in our hectic lifestyle, where women are having children beyond the age of 30 and breastfeeding, these do not have, these are all high risks for, I would say, breast cancer. And drinking alcohol, smoking, these are all risk factors which can definitely be avoided. So these risk factors, if you could take care of, I'm sure more than 50% chance of developing breast cancer can be prevented. So, having said that, what exactly do we do? In spite of doing all this, if you still develop breast cancer, then what all can be done is what we need to know. So, most important is, I would say, you have to understand that what we have is a complete, it's like having a quiver full of arrows. So, we have so many different ways of treating breast cancer. So, even if today you decide to, you find a lump, you decide to get yourself investigated, then what all investigations does one have to go through? So the first is you undergo a clinical evaluation. Then you have to undergo radiological evaluation, either with a ultrasonography or a mammography and tomosynthesis, which is a kind of a mammography, or in high risk cases or cases where even mammography is unable to pick up anything, but there is high suspicion or in a genetic history. In that case, we also recommend an MRI breast. So these investigations, radiological investigations, are done to first confirm that there is suspicion of breast cancer. After that is your biopsy, which needs to be done to get some tissue diagnosis. So actual third stage is to get a tissue diagnosis. So we take a piece of the lump and we subject it to histopathological examination. So these would be the different examinations that one could do to arrive at the diagnosis. Clinical, second is radiological, and third is pathological with the biopsy. Once these things are done, and if there is a genetic history, then we also recommend genetic tests, but not in each and every case. Once this has established a diagnosis, then the next set of investigations is to see whether this breast cancer has spread to other parts in the body. And that ideally is done with a PET CT scan, which gives you an idea of whether it has spread to any part of the body. For this, what we do is, it's a very interesting test. I don't know how many of you all have seen it or done. What we do is initially we starve the patient and then we inject a radioactive material with which glucose. Now, every cancer cell in the body actually is hungry all the time. So it needs this glucose. So this radioactive iodine, which is sticking onto a radioactive material that is sticking onto the glucose, enters the cell, and wherever these cancer cells are accumulated or deposited, they show up as bright spots on the scan. And that gives us an idea where these micro deposits are, right? So once you know that the PET scan has shown these deposits, if these deposits are not seen, that means it has not spread and it is still operable. If it has spread and you find them in a particular area, depending on which area it's affecting, whether it's the brain or the lungs or the liver or the bones, accordingly, the treatment differs. But yes, we can treat those too, at least to keep it under control. It's not never a curative response that you look for, but yes, it does keep the disease under control. So initially, we get a PET CT scan, see whether it has spread, and then plan surgery for the patient if the patient is operable. Now, even regarding that, if you see there are loads of different options available for the surgery. So, what all options, if you ask me today, I mean, if I go into the history, it all started with doing a radical mastectomy, which was pretty gory because it would you get rid of the breast, the muscles, the vessels, and everything used to be removed at earlier times. I'm talking about the probably the 19th century, 20th century, early 20th century. But slowly, over a period of time, we have been able to de escalate and make them less mutilating surgeries. So we came down to a modified mastectomy where we used to remove the breast, just the layer covering the muscle, and the lymph nodes in the axilla, in the armpits. And then that is what it was for quite some time. So even now, for those cases who probably don't want to undergo a breast conservative surgery, do opt for a mastectomy. But those number of cases are less. So what we do nowadays is we try and save the breast as much as possible. So we remove the lump and we take care of the lymph nodes in the axilla. Now you'll ask me, what are these lymph nodes in the axilla? So when I talk about the axilla, I mean the armpit. And what happens is that the entire breast drains into the lymph nodes in the armpit. And all the blood, the lymphatic fluid goes into the lymph nodes in the armpit. And from there, it enters into the rest of the body. So the first place where any breast cancer could spread would be to the armpits. So we need to remove those lymph nodes and initially test them and see whether it has metastasis. So sometimes it happens that by the time the patient comes to us, these lymph nodes are already so large that we can feel them clinically on examination. Whereas sometimes a patient is very alert, realizes that there's a small lump, comes to us at an early stage, and we find that it has not, the lymph nodes are not palpable. So in that case, we do what is called as a sentinel node biopsy, where we inject a dye near the basic tumor and we remove those lymph nodes from the armpits and subject them to what is called as a frozen section. And within 20-25 minutes, we get the report saying that it is either positive for metastasis or not. If it is negative, we don't remove the rest of the lymph nodes. If they say it is positive, then all the lymph nodes from the armpit are also removed, taking care of the loco-regional clearance, right? Having said this, this is the norm as of now. But, you know, we are not the kinds to sit quiet with just getting only this much done. So we have now come up with better and better surgeries where we try and do a nipple sparing surgery, where we do a nipple sparing mastectomy. That means we leave the nipple areola intact and we just remove the breast tissue from under it, right? And take care of the lymph nodes. Or we can, there is now even the latest things, the robotic mastectomy that is being done. So there are loads of surgeries that have come up which are one better than the other. And depending on what stage you're in, you decide which surgery is the best for you. But most important point to remember is that when you're saving the breast, you 100% need to undergo radiation. So radiation has to be given for every breast that is being saved or conserved. And apart from that, in cases where the tumors have been so large, like more than 5 centimeters, or there are more number of lymph nodes in the armpits, in that case, we do give radiation in spite of doing a mastectomy. So it is tailor-made to each and every person's situation. So we can't have one size fits all. Apart from that, we also have the third option. So surgeries is one thing, radiation is the second thing that we do. The third thing, depending on the histopathology, is to get chemotherapy. I'm sure everybody has heard of chemotherapy and its so-called side effects, because every patient that comes to me is so apprehensive about chemotherapy because they've heard that so and so underwent chemotherapy, she had problems, she vomited, she this, that. I don't want chemotherapy. It's the first statement. But believe me, these stories that you're hearing of are of people who had undergone chemotherapy earlier, where the drugs were different. Now we have better drugs available, better control of side effects. So it's much better therapy available today than what it was maybe 20 years earlier. So please, I would suggest don't compare with what you hear outside. Do trust your physician and have a one-on-one relation where you actually sit and talk, get your doubts cleared, and go for it completely, safely. And in all this that we talked about regarding treatment and everything, what is it that you can do regularly? As the slide says, it is basically breast self examination every month after 4 to 5 days of your periods. And those women who have already undergone a hysterectomy for some reason and are obviously not getting any periods, you can pick any date, maybe first of a month, and then follow accordingly and keep checking yourselves out at that point. Main thing is to understand what is the texture of the breast. What is it that is a normal breast for you? And then, if any changes take place, you will be able to pick them up very easily. Second thing I would say is don't have to get worried if you do find a small lump. You don't have to start panicking that it's breast cancer. Give it a month or two. Wait and see, because sometimes what happens is there are these water filled bubbles that come up, which are called cysts, which come with every period cycle, and they do subside after periods. Sometimes they stay back, they maybe regress in size, but they do stay back. So observe them for a couple of months before worrying about it. And if you find that it's increasing in size, the lump seems to be increasing in size, or if it seems to be something you can easily get yourself checked out, get a sonography, and you know put your mind at rest. So don't have to get scared. At the same time, you need to be alert about the changes that are taking place. So self-breast examination every month, every 6 months examination with by the clinician. That again is an important aspect. So just as you do your blood sugars every 3 months or every 6 months or annually, please make it a point to get that breast examination also done routinely. What else can I say? I don't want to scare you. However, I find that a lot of people today, because of all of us, you and me included, we have such hectic lives. We are, stressed out with our work, time schedules, our deadlines, homework, and household chores, and our children, spouse, parents at home. So everything that is going on, we are so stressed out that we don't realize that it's affecting our body all the time. And at some certain point, the cortisol level goes up and all these problems start multiplying in the body. So do try and de-stress as far as possible. That would be the first, I would say, preventive tactic that I would like to mention. The second that I would like to say is 8 hours of sleep, something that none of us are getting. I don't think anybody is, and if somebody is, well, you're so lucky. But 8 hours of sleep is very essential. And the third, try and get some sunlight, though we have enough sunlight in our country. Yet we find that there's a lot of lack of vitamin D still happening. So I think we need to go out in the sun and maybe check our D3 levels also routinely and confirm. Apart from that, I would say eating 5 fruits a day is an important thing. All of us are constantly, you know, either drinking coffee, tea, or something to just, deal with our stresses and our through the office hours. Also, we are, taking breaks with tea breaks or coffee breaks. But tea and coffee has been seen to affect the breasts most. So I find that women who do come to me with mastalgia, with pain in the breast, if when I ask them to decrease the tea and coffee intake, the pain actually disappears. So try and decrease the intake of tea and coffee. Avoid alcohol, obviously, as far as possible. Exercise, a good diet. 5 fruits a day. When I mention, I mean it. Why do I recommend 5 fruits a day? It's because it increases your immunity. Now, cancer has been seen as an immunodeficient. In individuals whose immunity is slightly low, those people have also been seen to develop cancer. So I would prefer it if you can, build your immunity. So just as they say that even when you're stressed out, your immunity is low, and that is when these uh, diseases come up, these chronic diseases come up. Interestingly, an interesting observation that I saw that I've been observing is that a lot of my patients, when they come to me with lumps, and if I sit down and talk to them, I do ask them whether they've undergone any kind of what should I say, a stressful event in the past 1.5 years. And when they gradually open up, you realize that they have undergone something. Maybe it's, a job change or a loss, or, something to do with the kids or financial stress or something of that sort. So a lot of these uh, patients who are stressed out have lowered immunity and then do come few months later with the lump. So my sincere advice would be take care of yourselves, love yourselves, do enjoy humor, joke, laugh, and once in a while, just chill. I think that is the most important thing. Don't take life so seriously. Thank you. So I don't mind taking any more questions if anybody has any.
Thank you so much, Doctor, for that wonderful, wonderful content. It was so very helpful, so very nicely
Thank
paced
you.
out. I had actually a lot of questions, but just listening to you in the last 30 minutes, actually, you answered a lot of my questions. Uh, we'll now open the floor. You guys have the option to unmute. You please either type in your question on the chat. We have Dr. Ojas with us for another 20 minutes. Please feel free to shoot your questions and she'll be happy to answer. Doctor, you want me to read out the question? I see a
Yes, please.
on the chat.
Yeah, yes, please.
Okay, I've read that for women under 40 who aren't at high risk, mammogram screening isn't usually recommended. Is that correct? Other than self examination, what test or preventive checks would you suggest at this age to monitor breast health?
Ideally speaking, less than 40, we recommend ultrasonography. And it's only above 40 that you talk about getting a mammography done. The whole reason, like I said, is because of the breast being very dense. So the X-rays cannot penetrate a dense breast, which is, at a younger age. So ultrasound is one thing, or I would say MRI at the most if it's a highly suspicious tumor or there is genetic history. So these would be my main screening. Though MRI cannot be used as a screening test, nor is ultrasound used as a screening test. But in a younger age group, yes, ultrasound is the best thing to undertake.
So by younger, you mean people below
Less
40?
than 40. Less
Oh,
than 40. Yeah.
got it. Okay, do perfumes and cosmetics lead to breast cancer?
A very interesting question, but there have been studies where they have shown that it does, but to some extent, maybe yes. Not a major contributory factor, but at the same time, yes, to some extent.
Okay, just a follow up on this. Do you recommend any while purchasing a cosmetic product or a perfume, you look at a
No, no. Ideally, don't use the pressurized ones, is what they say.
okay.
But more than I think breast cancer, perfumes do have an effect on your memory. So they've been linked with Alzheimer's actually more than with anything. So maybe you could avoid it for those reasons rather than for the breast cancers.
Okay. There are some vaccine that come as precautions for breast cancer. Is it safe and should we take it?
There have been, yeah, they say they have come up, but right now they're not totally recommended officially. And let us see in a few years' time, things will be clear whether we should be taking them routinely or not. So it's not unlike the HPV vaccine for
Yeah.
cervical cancer, which is being recommended. There's nothing particularly being recommended for breast cancers.
Okay.
I think
What
there's
is
one.
breast fibroid?
Mhm.
Uh, Sorry, and any connection does it have with cancer?
Breast fibroids, you're
Fibroids.
saying? Okay, so these are called fibroadenomas, and these do not have connection with the cancer. It's less than 0.01% chance where a fibroadenoma could get converted into a cancer. So, that is not related to it as such. And they're generally seen in a very younger age group, these fibroadenomas. And there are chances that, it could be a family thing, so where the mother had it. But these, especially if they're seen around 18, 20 years of age, and then they either regress and become smaller in size and disappear with increasing age, or they remain constant, or they may grow further. So I wouldn't worry about breast fibroadenomas and cancer link as such.
Hmm. Okay.
Right? Yeah.
Is chest pain a sign of breast cancer or is it only due to acidity?
Now, that is a very good question because a lot of women come with this chest pain and they cannot differentiate between the chest pain being from the chest wall
Hmm.
or the breast or inside. So you need to get a few tests done to confirm where exactly does the pain lie. Interestingly, there is even a cervical spondylosis which could give rise to breast pain because the nerve supply is the same.
Yeah.
So you need to go to a clinician and get this sorted out. You cannot just compare one with the other. It just it's different. So you have to check it out.
Okay. Is there any link between PCOS and breast cancer?
There could be, considering the fact that PCOS is basically multiple cysts that are developing in the ovary. And though there is not a direct link, but yes, to some extent, the estrogens are a little higher. So you could say that the patient could be prone to breast cancers at a later date.
Is it like a high risk if a person has PCOS, they could be at a higher risk of.
I still wouldn't call it as that higher risk, but yes, you need to be a little aware that, okay, I had PCOS and, I need to get myself checked up. That's all.
Okay.
But yeah, I wouldn't, because PCOS is far more common than what breast cancer is.
Yeah.
So, it's not that every person who has PCOS will at some point of time develop breast cancer. That's all I'm trying to say.
Does silicone or stick-on bras lead to breast cancer?
Not to my knowledge.
Okay.
It doesn't. But yes, underwired bras at some point were considered as, to be avoided.
Hmm.
Basically, because the pressure on the skin doesn't allow the lymph that I was talking about, the lymphatic fluid to pass. That is why they used to say that, try and avoid underwired bras as far as possible. But yeah, silicone, stick on, I don't think, because this is just a local thing that is being applied. So
Yeah.
that should not give rise to a breast cancer.
Yeah. Okay, we have a question from Shivani. I've been feeling two lumps in my breast for the last 9 years, but I never had any pain and I never showed any symptoms. So I never got them checked. Uh, I think Shivani, your question could be that should you get screened for it? And maybe if we could know more about your age, that would be helpful.
That is exactly the age. And secondly, because it's 9 years, probably it seems to be more of a fibroadenoma, is what I would say offhand. But yes, you do need to get it checked out depending on your age, especially. So I would say just get it done. You at least get a sonography, get yourself checked from a clinician, and you should be good to go.
Yeah. Is tenderness during periods normal? What kind of
Yes,
bras,
absolutely.
yeah, what kind of bras should I be wearing to avoid the risk?
Okay, now tenderness just before periods, maybe up to 5 days before periods are considered normal. Anything more than 5 days and giving rise to a lot of discomfort, because we need to classify the pain. Now, not everybody has the same pain tolerance. So somebody who might be feeling pain might just be able to, learn to deal with it. But somebody might just feel that I'm very, I just can't manage. The criterion would be, I would say, to be able to, well, are you, it's like, what about intimacy? Is it difficult? Or you cannot sit on your two-wheeler while you're driving because of the bumps. So how is your routine getting affected is what you need to understand. And what kind of bras, I would say maybe around that time you could use some just soft padded bras or something to give a little bit of, comfort.
Hmm.
And generally, what happens is there's a little bit of congestion in the breast, which makes the size grow a little larger. So maybe one size bigger, or maybe adjusting your hook accordingly. So trying, or in the nights, if you can just release the bra and sleep without one, it's one of the best things to do. So just trying to adjust would help. Another thing for breast pain, like I said, avoid tea and coffee. And I always insist on this, and I found it very effective because you avoid tea and coffee, and a lot of your pain does go away. So try that if you can. That would really help.
Okay.
Okay.
If a father has a history of prostate cancer, does that add the
Yes,
chances? Okay.
yes, it does. It definitely increases the chances of developing breast cancer because breast and prostate are considered as brother sister organs. So their structure is almost similar. So yes, you should be a little careful.
Okay, there's a technical question. Is IHC CD34 highlights approximately 1
2%.
to 2% inters I'm not able to pronounce.
Interstitially scattered blasts related to cancer.
Okay.
This is a highly technical question, like you said. IHC, yes, there are markers that are used now. CD34, it depends on which one is affected. Like if it's a lobular cancer, then you have these which are highlighted. So I think this would be better if discussed one on one rather than in an open forum like this.
Okay. You answered the question for wearing a bra at night.
Yeah, yeah,
You can always loosen it or keep it without it.
yeah.
Shivani answered her age. She's 25. She's experiencing two lumps from the age of 17.
Yeah, okay. And she's now 25. Okay. So I think just get a sonography done and I think you should be fine because it's been there for 9 years and if it hasn't increased in size and, you know, if at all you're planning a pregnancy in the near future and if the lumps are more than 3 centimeters in size, then yes, I would say that, it's better to get them removed. But yeah, does tight, high impact sports bra can be harmful to the breast to wear? No, actually, no. It's not really. In fact, you need to have a tighter bra so that they protect rather than the other way around.
Okay. My mother-in-law was diagnosed with ovarian cancer only at the last stage, as there were no noticeable symptoms. I would be grateful if you could please share what early signs or symptoms we should look out for in such cases so that we can be more aware in future.
Oh, that's a beautiful question. See, ovarian cancer is one thing that goes highly, it's misdiagnosed in the sense it goes undiagnosed, I would say, because it literally has no symptoms per se, other than maybe an increasing weight loss or an abdominal distension because there's fluid collection, or there could be just, intermittent bleeding or something of that sort. But other than that, there is literally, it's very difficult to pick up. So, ovarian cancer is another thing that needs to be picked up with a routine USG abdomen and pelvis. So, you get an ultrasound done on a regular basis and keep looking at the ovaries. I think that would be the best way to pick up ovarian cancer. And when you suspect one, then you have to get the tumor markers and everything done. But mostly ultrasound would be the ideal thing to do. And of course, go to the gynecologist, get a regular per vaginal or PV examination done, and they will be able to tell you if there's anything suspicious.
So, how often could that ultrasound be done?
Maybe even once a year is enough.
Once a year.
It's more than enough, yeah.
Okay. Does the size of the breast is linked to a risk of a breast cancer?
It's not linked to a breast cancer, but at the same time, in a big size breast, what happens, a D cup or something, the tumor is hidden. So even if it's a 2 centimeter tumor in a A cup, A size, and a cup size of D, obviously 2 centimeters in a D size will not be picked up. So only from the fact that it gets hidden is the reason why it is at a bigger risk because it allows the tumor to grow larger. But otherwise, obesity, if it is a part of the obesity, big size of the breast is part of obesity, then yes, it is a risk for breast cancer.
Okay.
Right.
My family has a risk of hysterectomy.
Hysterectomy is
So, is
very
there
nice.
any risk or chances of having breast cancer in future for me?
No, I don't think so because if I did, whosoever underwent hysterectomy earlier, you have to understand why did they undergo, whether it was, because of ovarian cancer, or was it an endometrial cancer, or it was for a fibroid of the uterus. So knowing the reason why that person has undergone hysterectomy, and then understanding that it is not related to breast cancer. So if it had been done for an ovarian cancer where the patient has undergone hysterectomy with removal of both the ovaries, then yes, there is a high risk of breast cancer also. But it depends on the reason why it was done, rather than just clubbing all uh, hysterectomies together. I would rather say that you should know the cause why it was done.
End
Any,
of the questions on the chat for now.
okay.
Maybe
I
somebody.
think there's one asked by Nilima K, who was asked saying that I'm 35 and got a general health checkup, mammogram included. There was some small near the areola right breast. I got a USG breast and then tissue TrueCut biopsy of the lesion revealed benign blunt ductal adenosis. Okay. I can't feel the lesion or anything. What should I do next? Let it be. Okay, 35 and it was benign. Well, believe me, there's nothing to be done. You're safe because it is benign and nothing has to be done beyond that. But it's a good thing that you felt something and you got a USG and got a biopsy too. So for you, as of now, it is done. Now just see that you repeat a sonography every, I would say, year so that you know that there's nothing developing. That's all. Okay.
My mother had a triple negative breast cancer. Then she got diagnosed with leptomeningeal disease within a few days of her surgery. What could have been the reason?
Now it depends because now I'm not very clear on this, but I would say that it is maybe that did the cancer spread to the brain and cause this, or she had meningitis per se. Is it's not very clear, but I would say that breast cancer, like I said, spreads to the brain too. It depends, and triple negatives are known to be really bad in the sense the recurrence rate is pretty high, first of all, and they don't respond that well to treatment. So maybe it was a part of the treatment that led to the leptomeninges. Okay. I have DVT. Can it affect breast cancer or its treatment? Not really. DVT will not generally affect, but main thing is that you need to keep your limbs moving. And to prevent DVT, maybe you've been put on some blood thinners or something. So that could probably have to be adjusted with your current treatment. That is the thing.
A person who has undergone a surgery for ovarian cancer has developed a pain in the intestine. What do you suggest?
This time has happened now. The person is suffering from pain. You'll have to get this checked out because sometimes what happens is during surgery, any surgery could give rise to adhesions inside the abdomen. When they open and they actually operate, the intestines could get stuck to each other, and they're just thin fibrins. So as a result, pain, vomiting, or a distension could happen. So I would definitely suggest that you get this investigated either with a CT scan or with a ultrasound or something. So this becomes a little a general surgery kind of a treatment that you've got to look at in
Okay.
this case.
I just stopped breastfeeding my child before 1 year. Still, sometimes I get some yellow fluid from one breast. Should I get it checked with my doctor?
No, that's fine because it will take some time for this to reduce. And if you're expressing it out, pressing it out, then only it will come probably. But as of now, I would suggest don't do anything. Wait for another 6, 8 months. It's quite probable that it will just settle down on its own. So as of now, wait.
Do late marriages, are late marriages a reason for cancer? What is the risk percentage for
Lay,
couples who remain married or single?
it is on the higher side risk of those who are unmarried. Yes, I mean, I wouldn't call it unmarried. I would rather say whether whether you have had kids or not is what the whole thing boils down to. So yes, those who are nulliparous, that means who have not had children, yes, the risk of breast cancer is on the higher side. And well, late marriages, consequently everything is related to that. So main point is whether you've had children or not. Marriage per se is not the criterion. You
Okay,
could,
so
I
I
mean,
mean,
considering today's day and age, you could have a baby even without marriage. Or so I wouldn't link it to marriage as such. I would say having a baby is what is protective or not.
okay, so you're recommending that people like women should like have babies to reduce.
Ideally, yes, they should have at least one child and breastfeed for at least 1 year,
Okay,
is what is recommended. And that too, now they say before 30 you should have a baby, but it's not possible. Now a setup and the kind of, uh, lifestyle that we have today, where we are working, we have our careers in front of us. So I would still not be so hard and fast about the age per se, but yes, try and have at least one child and breastfeed the child. But if it's possible, well and good. Otherwise, if you keep undergoing IVFs are also considered a slight higher risk because the kind of hormones that you have to keep taking. So that is again something that has to be balanced out.
okay. Any surgery you recommend for reducing breast size?
There are breast reduction surgeries done, but it depends at what age and for what reason. So, if you're just going to do it for cosmetic reasons, yeah, you need to really be clear about why you want to do it. Most of the people, because these things are not generally covered by insurance, honestly speaking. So, I would suggest that if you have to undergo, it has to be for a D cup or a double D cup size. And if there is any cervical spondylosis because of the heavy breasts, there's woman ends up literally having a backache. So those are the reasons that yes, they do undergo reduction surgeries. Or if a patient has undergone breast surgery in one breast for breast cancer, then the other breast is large. So then they reduce that. So it's a therapeutic thing. So in those cases, yes, they do reduce size of the breast. So, but for cosmetic reasons, then only if you have already completed breastfeeding, then do we consider a breast reduction. So if you're, let us say, in your early 20s and you haven't had a baby, don't go in for a breast reduction surgery, as far as possible, because you still have to go through the breastfeeding. So give it some time.
Okay. My
Uh,
maternal grandmother is dealing with stomach cancer, and my mother, including her family members, already has undergone a hysterectomy. It nearly caused cancer, so they had to operate. Is there any chances of breast cancer?
Stomach cancer, well, no, that does not have any relation with breast cancer as such. But if somebody has already undergone a hysterectomy, you need to find out why exactly did she undergo, whether it was endometrial cancer or what exactly. In that case, yes, the chances would be slightly higher. And with stomach cancer, no. Colon cancer, yes, that has definitely high risk for breast cancer.
If someone has difficulty in conceiving, does it increases the chances of cancer in future?
A little difficult question because it may or may not increase because, like I said, you are taking hormones. So there is slight chance, but it depends on how many cycles and what exactly you have done. So difficult to answer this particular question without knowing exactly what you're undergoing.
Hmm. What about those cases where mother is not able to feed the child after delivery due to certain complications? Is there any specific time period for females to feed the baby, which results in less chances of breast cancer?
Very good question. Now, see, in those who cannot breastfeed, now you can't help it. So you just cannot, hold that as something. But you do need to know that you have not breastfed. One. Secondly, ideally, anything more than 6 months up to 1 year is considered as protective for the mother. And now we have people who breastfeed for less than 3 months or maybe just 3 or 4 months and then, wean off the baby. So in those cases, that is not considered protective for the breast. So anything that is more than 6 months is considered protective for the breast. So would you definitely, be able to take care of these little things? And keep in
Sure,
mind, so if you're breastfeeding, at least for 6 months, if you could go on, that would be best.
sure.
Yeah.
I forgot to ask you, doctor, where are you based out of?
I'm based in Pune.
Pune, okay.
Yeah.
Sure. So we are just over time also, and thank you so
Okay.
much, doctor, for spending this time with us. Really, really thankful to you.
Thank you
Would
so much.
request our partner Manushala if they could share the PPT with us, and we'll make sure that we bridge this gap of if someone wants to reach out to you, they are able to, and maybe
Sure.
get a one-on-one consultation as well.
Sure. No issues. Anytime. Most welcome. In fact, it was really nice to interact with so many people. And I'm glad women are actually interested in taking care of themselves. It felt really good. And thank you, Manoshala, for organizing this. So thank you so much for having me.
Thank you so much.
Yeah.
Thank you, everyone. I'll reach back to everybody with the insights from the session. And thanks again, and have a great day ahead.